What's crazy, after having my own kid, that's a different experience, baby. Before,
All right, good morning, everyone. Welcome to the New York City Controller's Office. I'm Controller Brad Lander, and I am delighted to be here in advance of Mother's Day on Sunday with some extraordinary advocates for and service providers to mothers to highlight some important work that has been done to address Black and Hispanic maternal mortality rates and to improve birth outcomes for communities of color here in New York City. So I want to recognize we've been joined. Usually, Citywide rank goes first, but it's for Mother's Day. For this audit, we're going to do, moms, people who gave birth. So City Council Member Jen Gutierrez, Public Advocate Jumani Williams, and a great coalition of folks, including a couple of people that run and staff the Doula program at Caribbean Women's Health Association. So thanks to all of you for being here. It's also, yeah, yes, there are staff babies and pregnant staff with us as well. But we are, look, this is really a critical issue in New York City. The rate of Black maternal mortality is 6 times that of white women in New York City, 6 times. So this is a crisis. The good news is we know something that works. And I'm pleased because it's not all that often that we have extremely positive findings to announce in an audit of the Adams administration. Most of the audits that we release reveal huge gaps in service. They sometimes reveal fraud, they reveal waste, they reveal programs that aren't working, and we have not been hesitant to release those results and talk about them. But we audit city agencies broadly, we look at programs broadly, and we decided here to look at the New York City Department of Health and Mental Hygiene Citywide Doula initiative, motivated by the horrific racial gaps in maternal health outcomes. Here's a program designed to do something about it, and the great news is this program works. The Citywide Doula initiative is dramatically improving maternal health outcomes for the families it serves, and that's what this audit shows, and we are delighted to have the opportunity to present it today and to honor the hard work that people have been doing to make that happen. Because organizations like Caribbean Women's Health Association have long been working to expand and provide doula care for New Yorkers, especially in low-income neighborhoods and to birth givers of color. Elected officials like the public advocate and the council member have been working hard on this. Councilmember Gutierrez sponsored and passed Local Law 85 of 2022, establishing a pilot program to train doulas and provide free doula services to residents of marginalized neighborhoods in New York City. The public advocate has long been crying out against the maternal mortality rates and the disparities, especially in New York's Black communities, and pushing for programs that do something about it, as he focused on for a long time in the past, but also most recently during Maternal Health Week in New York City. And that is part of what led us to focus on and do an audit of the Citywide Doula initiative to see if it was meeting its objectives to increase access to doulas in communities of color and to improve maternal health outcomes. As people in the room know, but we won't assume everyone in the public does, doulas provide non-medical, physical, emotional, and informational support to pregnant individuals and families before, during, and after childbirth. So they help people get ready, they help people during birth, and then they follow up to help with breastfeeding and support in the days after birth. And by making doula services at low to no cost, the city is making progress toward closing the racial gap in maternal health outcomes and on the way to eliminating maternal mortality. That should be our goal in New York City. Our auditors, and I'll recognize them individually in just a minute, reviewed citywide birth outcome data from 2022. Yeah, you like that data? Published in the most recent annual summary of vital statistics. I think Guy is saying, I was included in those statistics. And birth outcome data for the period of March 2022 through June 2024 for the Citywide Doula Initiative clients. And they also did a survey of both participants and doulas in the program. And here's what they found. First, meaningfully increased doula access. DOHMH's efforts are increasing doula access and support in underserved neighborhoods. Prenatal visits, doula-attended births, and postpartum visits all increased significantly, with over 2,000 clients receiving services through the Citywide Doula Initiative program. Most important, we saw improved mental health outcomes. So Black and Hispanic clients of the Citywide Doula Initiative saw significantly better maternal health outcomes, and this included lower rates of C-sections among participants in the CDI program relative to birth givers at large, fewer preterm births, and fewer babies with low birth weights compared to citywide averages. So across those key health indicators, the program is working. For C-sections, for example, about 5% improvements instead of about 38% of babies with low birth weights to Black mothers, about 33%, 5% reductions, and all the data is in the audit. One thing I'm happy to say is that there were no pregnancy-associated deaths that were reported amongst the CDI clients. And that is not a large enough sample size to compare, but it does suggest that doula support may well help maternal mortality in addition to meaningfully improving maternal health outcomes. Excuse me. And one other thing that we saw in the surveys is real satisfaction with the program, with 77% rating their pregnancy or birthing experience with a doula as good or excellent. Happy to say that of the providers, Caribbean Women's Health Association saw some of the highest satisfaction rates, so props to the folks here who are doing that. And there's some great quotes that our auditors got as well, including one respondent who stated, having a doula was life-changing, and more clinics and hospitals should offer it to all patients. And we could not agree more. So thank you to all of you guys for doing the work, doing the advocacy, fighting the fight to make sure that we can bring this data out there. We did identify some areas for improvement, as auditors are supposed to do, and I'll tell you a few of them. We did find that doulas still face barriers at delivering care at hospitals. Many of the hospitals have come to embrace doulas, but there is still work to do. 17% of doulas reported that hospitals prevented them from providing comfort measures. 25% were prevented supporting mobility out of bed, and 13% of doulas reported they faced challenges staying with their clients during delivery. A number of the clients are pregnant people in shelters, and they faced inconsistent doula access due to delays in caseworker approvals or outright denials of access by shelter staff. 49% of doulas said that their clients were inaccessible or difficult to access because shelter providers wouldn't let them in. Thankfully, DOHMH is already working with Department of Homeless Services on this, but we need to continue the work to make sure that doulas can get into shelters. And finally, there are language access gaps to address. While 6 of the 7 vendors stated that they could provide services in Spanish, fewer than half the vendors could provide services in other languages. 3 of 7 offer services in Haitian Creole, like the folks here, but we need more resources there. 2 in French, and just 1 each in Cantonese and Mandarin. So that's another area that we can improve by making sure there's more language access. And of course, one other area we can improve is just providing the resources, because it was great to provide these services to 2,000 pregnant women and birth givers over the past 2 years, but many, many more women gave birth during that period of time. And if we really want this to work, we have to scale it up big. This program can be part of a growing continuum of support. And let's think about it. If we are providing sex education in all our schools, so our kids are learning about what it's going to be like, if we are making sure that contraception and reproductive health care are accessible and available to all people who need it, if we are providing doula services to everyone who's pregnant and making sure that they can get these services, if we grow the nurse-family partnership that helps young families get the health supports that they need, if we expand universal child care so that early childhood education begins when kids are just starting to grow and learn, not just at 4 or at 3, but at 2 or at 18 months or even younger, we can truly make New York City the greatest place to raise a family of anywhere on planet Earth, and that is what it should be. I'm a dad of 2. They're a lot bigger than some of the ones up here. But some of you may have seen that earlier this week, I got to have a pretty special moment with my daughter in New York City as well. I feel so lucky to have raised both my kids in this city, and what we want is for every single family to be able to do it safely, to get the supports they need, to have the health outcomes we want for all our parents and all our kids. And this program, Citywide Doula Initiative, is one critical step in that direction. I want to thank the auditors who did this good work, who are in the room. The audit is now available online, and we've got a copy here. So thank you to Edward Carey, Ernestine Rivers, Richard Riccobono, Joe Batista, and Sandra Williams from our Audit Bureau. Please give it up for them and their good work on this audit. And now I'm delighted to have you hear from a few of the other people up here. And Public Advocate, I hope it's okay with you if we go first to, as I mentioned before, there has been no better champion for young families and what it takes to raise a kid in this city than Councilmember Jennifer Gutierrez, herself the mother of 2, including one pretty recently. But long before that, she has been fighting for the expansion of childcare, for our childcare providers, and a fierce advocate for doulas as well. As I mentioned, it's her legislation that established the citywide pilot program, and it is my delight to introduce you to City Council Member Jen Gutierrez.
Thank you, Brad. Thank you so much. Thank you to our comptroller and his wonderful audit team. And I was ecstatic when I got the message saying the audit is done and it's good. And I said, let's schedule this tomorrow. I want to hear good news before any other kind of news. And of course, want to thank everyone who's up here with me. Of course, our public advocate and the providers, the doulas who've been doing this work long before the legislation, long before any cohort of elected officials were really talking about it. Doula care is ancestral. My grandmother was a doula in our hometown in Columbia. And so I'm always honored to really elevate the work that they do, because I know firsthand how effective it is, how much safer pregnancy and postpartum care can be with the care of a doula. I was lucky in both of my birthing experiences to have a doula. I know, girl. And it was 100% positive. And when I had my first child and started working as a council member, I said, I'm aware that the experience that I had was such a privilege because I had a doula with me. I had an advocate with me in the room the entire 36 hours I was in labor. But my experience should not be just a rare occasion. It really should be for every single birthing person to have that option. And I don't want to speak for my husband, but I know he was excited there was a doula in the room as well. So it really works, not just for the birthing person, but their loved ones that they're with. The pilot and the audit I'm so grateful for, because it really reveals what I think so many of us knew already. It just helps codify, and I think hopefully at some point really extend the lifeline of this program so it's not a pilot, and get real money invested so we can expand beyond the 33 communities, so that we can invest in outreach, so that we can make sure that every single community, AAPI, Asian communities also have access and understand the values of doula care. But I'm just so honored that this audit, in partnership with the comptrollers, doing what I think we've all been saying collectively, which is protecting Black and brown women is protecting all women. Keeping them alive should really be at the center of a lot of the policy work that we do. And I'm so privileged that I was able to pass this bill, and in the bill also create specifications for trauma-informed care, there were a lot of benchmarks that we added into this bill so that we could be as inclusive as possible, so as we could be as thoughtful as possible. In meeting with the doulas thereafter, I heard their feedback, and I'm continuing to hear their feedback. Like the audit shared, there are some limitations to the work that they can provide, whether it's at the hospital or a shelter, for example, and we want to work through that. We don't want any barriers for any person to access doula care, either while they're pregnant or afterwards. And me, speaking personally, my doula is my family at this point. I told her it's blood in, blood out. And there is such a bond and a relationship there when a pregnant person, when a woman can bond with another person, and you know that they have literally protected you. It is a lifelong bond. And I think that if that is one of the benefits, besides keeping women alive, it's such a value to our city and our communities and our health overall. So thank you so much to the comptroller and your awesome auditing team. And I look forward to extending and working to extend this program so that it's not a pilot, making it permanent, expanding, and investing real dollars into it. Thank you so much.
Thank you. Thank you so much, council member. Another person who was a fierce advocate, for families long before he himself became a father, but who the experience of becoming a father, I really got to see change how he thinks about these issues and become an even more passionate and effective advocacy for families, is public advocate Jumani Williams.
Thank you very much. Peace and blessing, love and light to everyone. First, thank you, as I mentioned, comptroller, for doing this as close to noon as possible. And thank you for this auditor and your auditing team and our council member who's been championing this and our doulas. And the baby, who's awesome. Look at that smile. Clap for baby. So Sunday is Mother's Day, and we celebrate with our families, with our moms. It's important to acknowledge the challenges that our partners, our parents had in becoming mothers, and becoming parents, the challenges that prevent many others from reaching that dream and that goal. As folks know, I've spoken many times about the maternal health challenges that my wife and I faced before bringing our miracle baby Amani into the world to meet her sister Amelie. Maternal health is an issue that is very personal to me. To see so many New Yorkers, but one that is so often under-discussed and under-resourced. And so I'm glad to stand here today with the comptroller, with so many others, with the council member, to discuss these new findings and how we can better support mothers through pregnancy, through birth, and postmortem. Last month, as mentioned, I released my own report calling for birthing centers in every borough. The effort to expand doula access is very much part of the same strategy. Thanks to dedicated advocacy of families, of elected officials, the issue is finally getting the attention and the funding and the resources that it deserves. It'd be remiss without saying that it's coming a time when we finally have a majority women city council led by the first Black woman city council member. Now we need to focus on getting those resources where they can be most impactful for New Yorkers most in need. And midwifery care, birthing centers, and doula access are essential to correcting the systemic failures that have caused far too many tragedies. Doula services are working, they're working well, part of the comptroller, but as the comptroller has pointed out, we can do more to make them more accessible and to integrate them more fully within the hospital system. Birth equity is a social justice issue, and today's recommendations can help bring care to communities too often underserved and lower the economic barriers that have prevented some pregnant people from getting and seeking critical care. My family's experience of seeing what my wife went through, not only now, but through her life, strengthened my resolve and molded me into a fiercer, louder, and passionate advocate. Too often, Black mothers' pains are not believed, plans are not adhered to, and lives are being put in danger. Unfortunately, we see it time and time again, even in our city, where the rates are actually worse than the national rates we've seen, which makes no sense at all. New York City should be, of course, better. I do want to say, at least, I do believe now people are starting to listen, people are paying attention, there's actions that is being made. The experience that my wife had when she was single, didn't have a particular career path, was very similar to when she was married and had a very good career. And so whether it is a city worker or a Serena Williams, and they discuss the only difference in their care is how much melanin is in their skin, that is a crisis situation that we should not be ignoring, and thank you for that agreement. Like she's saying, yes, absolutely. So, shout out to the comptroller. Shout out to Councilmember Gutierrez. Shout out to Borough Presidents Gibson and Reynoso and the speaker and so many others who did everything they could to lift their voices here. It's going to take all of us. It's going to take all of our efforts to reverse trends that have caused so much pain. When a program is working, like the Doula Initiative, it's time to double down and expand it to make sure the benefits reach people equitably. I'm glad to stand here with the comptroller today to push for these services, to meet people where they are physically in terms of language and in terms of greatest need. And one of the reasons I try to be as fierce as I can, I'm trying to do without getting emotional. I didn't believe my wife at first with some of the things that she was saying. That's something I carry with me. But I'm thankful that we found a doctor that really understood more, happened to be a black woman doctor, than the original. And so I try to take those lessons and that pain and really make sure that other folks don't go through that. And thankfully my wife and my baby's experience turned out great. A lot of people's have not. And it's just painful when you know the only reason is because how much melanin was in their skin. And we see things that are working. As I mentioned, we don't see it all the time, particularly as administration. Let's double down. Let's get it done. Thank you so much for everything, and thank you.
Jumani, I'm moved by that. Both your, talking about your about India, but also about your mom. That I'm going to share. This is not about black maternal health, but it is about racism in healthcare. When Jumani and I were both council members, he wound up in the hospital with a health situation, and I went to visit him, and it was very clear that something was was not right. I mean, he was in a lot of pain, and I was like, Jumani, you're in like a lot of pain. Something is not right here, and the medical staff at the hospital had basically been like taking aspirin. Like it was very clear to me in a way that like I knew like intellectually happens. That black patients who report pain could be just treated as though they were, complaining. And there was a very serious situation that needed to be attended to. And, I think it's easy to think this is about socioeconomic indicators, and there are plenty of challenging socioeconomic indicators this program addresses. But when we talk about disparities in healthcare, we really are, in many cases, just talking about racism.
By the way, they were calling security. My sister's a nurse, my mother's a pharmacist, and that still was what we experienced.
Yeah.
Life-threatening.
Yeah, so, unfortunately, systemic racism still exists in our healthcare institutions, and we have an obligation collectively to do something about it. Thankfully, Jumani came through that, and thankfully, India came through birth, but as he said too many times, that doesn't happen, and that's on all of us. So as we stand up and confront racism throughout our city, including in the healthcare system, when there are programs that work like the Citywide Doula Initiative, it is critical that we lift them up. So thank you again to our auditors. I want to recognize and acknowledge and actually just ask to introduce themselves if they would. The folks who are here, they're not going to speak, but whatever, this is the work that is critical. So we have folks from 2 of the 7 contractors in the Citywide Doula Initiative, Caribbean Women's Health Association and Brooklyn Perinatal Network. And if you guys would just introduce yourselves and say what you do there, that would be great. Oh, no, you don't have to speak, just introduce you.
Hi, I'm Lisa Joseph, and I'm the fiscal manager at Caribbean Women's Health Association. It's good to be here.
Hi, I'm Antoinette Latrice Waring, one of the doula coordinators at Caribbean Women's Health Association.
Good. It is still morning, right? Good afternoon. I am Denise West, the Deputy Executive Director, Chief Program Officer of Brooklyn Perinatal Network, and we are really thankful that we have the Citywide initiative as well as City Council discretionary fund for the Healthy Woman, Healthy Future program, because doulas should be a right for every woman, not extra, but a right for every woman. So we're really thankful to the controller, the council members, Jumani's office for supporting doula work. Thank you.
Right. Thank you. Thank you so much to our providers, and I guess let me also just recognize we're also joined by Kat Almonte da Costa, who led DEI work at Sotheby's and has done a lot of work on these issues in her own right, not representing anyone else here. She does happen to be married to Deputy Controller Ricky da Costa, and Emily Mayer, who's our Director of Intergovernmental Affairs and was before that the director of the Progressive Caucus in the City Council, and who I was told it was all right to acknowledge is pregnant and is here as part of our team advocating and supporting for the expansion of doula services and work on maternal health across New York City. Again, thanks so much for the audit, and thanks even more to the people who do and who advocate for all this important work. All right, we'll take on-topic questions and.
On-topic questions, Andrew?
You guys were so informative that I'm good on that.
All right.
But I do have an off.
We have
Great.
an off-topic, so if anyone would like to exit stage left or right, I would be happy, although.
Thank you. Don't make me embarrass you.
Yes, if the public advocate
As a
could stay.
public advocate.
Stay for one quick point. The off-topic question, as we speak, the mayor is in Washington, and he's meeting with President Trump at 3 o'clock today. And what he said is that he's meeting to discuss federal funding for the 5 boroughs and infrastructure and how the president can help New York City. I'm just wondering, do you take that at surface level? Is this a good meeting, or do you have concerns about it?
Eric Adams is running a real-time experiment in how you could capitulate in the most humiliating ways to an authoritarian bully, and New York City not only is getting nothing for it, New York City is suffering worse because of it. And you could just see it in real time. No other city had Elon Musk steal $80 million from our bank account, only the city with a mayor getting a pardon and bending the knee. No other city has the transportation secretary trying to cancel a program that is raising billions of dollars for transportation and reducing traffic congestion. Only the city where a mayor is willing to say he'll do whatever Tom Homan and Donald Trump want. I'm not aware of other cities where the administration is insisting on putting ICE in the middle of their correction system in violation of New York City law. What we need right now is a mayor who will stand up and fight for the values of New Yorkers, to protect our immigrant neighbors, to fight for the civil rights of New Yorkers, to fight for our budget and protect it. And this humiliating capitulation is getting nothing for New York City, and it is failing to protect New Yorkers.
For the public advocate, it isn't part of his job, really, didn't the mayor talk to the president and say, hey, we need this federal funding, or do you not think that's what's happening?
So I think it is 100% correct for a mayor to meet with whomever can help the city. I think it's correct and right for a mayor to meet with the president. I think this is the wrong mayor and the wrong person to meet with the person who basically removed the ability to even look into issues that very many people had concerns about. And what we see in Colombia is the best example. Capitulation does not stop harm. And so I think he's being really good at being the deputy president. I don't think he's being really good at being the mayor of the city, of a lot of folks who are very concerned right now. And so when you have people who supported and voted for Trump saying that he may be going too far, except for the mayor who says, thumbs up, hats off to what they're doing with ICE as they're deporting citizens, as they're refusing to do what the Supreme Court has said they should do, as they're trying to deport students, people who are here illegally. It's very scary. And so my hope is that the mayor would step out and talk about what he's going to do to protect New Yorkers from the worst of what's happening to the president. But part of his deal has been, and he has said this out loud, that he will not criticize anything that Donald Trump does publicly. I don't think he's criticizing anything Donald Trump does privately. And so I'm very concerned about this administration and their ability, I should say, their want to protect New Yorkers. I thought it was just part of the deal, but I'm beginning to really believe he believes in the policies of Donald Trump, and that's why he felt it wasn't a deal. If he was going to do it anyway, why not get something for it? But we are facing real harm, and there's limited scope in what a mayor can do. What they could do is not champion those harmful policies, and that's what he's doing, and that's what's most concerning to me.
Thanks, guys.
All right, thanks.
Happy Mother's Day.
Thank you.